So the enrolment process is a voluntary practice here in NZ, but there's huge benefits for a patient to become enrolled at a practice. In New Zealand, the majority of GP funding is provided via capitation funding. Capitation-based payments is not centered around the number of times the patient comes in through your doors, but it's based on the number of patients that's enrolled at your practice. But the total number of eligible New Zealanders who are not currently enrolled is not accurately defined, though it's indicated to be a substantial gap of New Zealanders who are eligible to enroll, but have not had the chance or are not currently enrolled with a clinic. The enrolment process is quite a cumbersome process that requires manual entry of patient data by the patient, but also, again, manual entry and verification of data and documentation by your practice staff. So the main steps in the enrolment process is identifying patients who are required to be enrolled when they're coming through your doors, capturing details in a paper-based form, electronic form, whether it's a PDF or a web form that you've built into your practice website, validating the patient's identity and creating a record of the patient with all of their information into the PMS application. So Medtech 32 or Medtech Evolution, or if you're using a different practice management software. Finally, processing the patient's record, including updating the NES web service with the information that you've captured from the patient. So the question raised is, how can we improve the process for both practices and patients through this enrolment process? So how does a form work? So the goal here is automate the end-to-end process of enrolment with minimal effort required by your practice, allowing your patients to enroll electronically for their demographic the information and eligibility documentation to be then ingested into your Evolution system for review and approval by your staff. The steps required by practice are still to confirm the identity or the proof of identity of the patient, the content of the enrolment application, the NES syncing, and also the transfer of record requests. So when you go to initiate the request of the information to be sent to your practice, we have plans to automate the transfer of record request in the future, but the steps to confirm identity and enrolment content in the enrolment form is an important step that still needs to be executed by practice staff. So how the form works, the form is integrated with Evolution through our Alex platform, and Alex is Medtech's integration platform that provides a secure and standardized method of integration. The form uses Alex to retrieve information in your Evolution setup. So it's a new setup screen in your location settings in Evolution, and to send data back from the enrolment form that was captured to be reviewed by your staff. And we'll take a look at what this looks like shortly when I go through the product demonstration. The prerequisites to set up the form, you first need to upgrade your Evolution to version 6.2, which is the latest release. It was released at the start of February. Many of you have already completed this, but in the case you have not, please contact your IT provider, schedule a time to upgrade your Evolution version. The next step is to activate Alex. So this is a process that we've got underway at the moment. We're working with many IT providers to get this activation complete. So a lot of the practices using Evolution or Medtech 32 will already have Alex activated. In the case that you're not sure, please contact our support team. We'll provide assistance and we'll contact your IT provider if you have not yet activated Alex. Following these steps, there's a bit of minor configuration in Evolution in your location settings to get this form ready to use. So we'll look at that following the product demonstration of the enrolment form, just so you can see the Evolution setup. So it's quite an easy setup in your location settings. And finally, you have to add a new button onto your Evolution ribbon, which is managed through the access privilege settings in Evolution. So the feedback we've got from customers so far is that it's a very easy tool to use. It saves a lot of time from not having to create a patient manually in Evolution and having to enter the data back in along with scanning documentations. The enrolment form automates this whole process for them. There's been a lot of feedback from the customers about what they want to see added into the enrolment form, and we appreciate everything that they've sent back to us. So the team are in the process of planning out the future enhancements to the enrolment form, and all of these are based on the feedback that we're getting from our customers. So please continue to send them through to us for the practices who have been using it. Thank you for getting it set up and for all the feedback you've given to us so far. So we'll jump into the enrollment form. So I will be switching in between the enrollment form, which is a web form, and Medtech Evolution. So just confirm, can the team see my screen? Perfect. Okay, so you can see the Medtech registration and enrollment form, and I will be switching in between Medtech Evolution and the enrollment form. So this is the Medtech registration and enrollment form, and it's a standard web form that Medtech hosts. So you're not paying the cost of implementing a new web form at your practice. It's a service provided to Evolution customers at no additional cost because it's included with your Medtech licensing, that you can get it set up once you've upgraded to 6.2 and once you've activated Alex, which both of those are part of the normal processes of Medtech upgrades. So there's some configuration which you can see on my specific form, which has a practice logo where you can see Medtech Alex at the top left-hand corner. And also you can see the header here where you can see my practice's name, contact number, address, EDI, NZMC. These are all customizable, so you can include what information you would like to be displayed to the patient. Some people have their email address, doctor's contact information if you want patients to contact direct, and it's customizable in your Evolution settings, which we'll see a bit later. So this is a standard web form, which has a bit of customization that's done in your Evolution, but all the wording and all the questions that have been asked is the information that's purely required for you to enroll a patient based on Ministry of Health or Te Whatu Ora requirements. So you may find in here that there's some specific PHO requirements for enrollment, that have not yet been added, and please send those through to us so we can review those and get those added in as soon as possible. It's been a product that we've got to market within a few months, and the reason we've got this out is just so we can get that feedback from the customers to understand what you require to be included in the form. So the registration and enrollment form has two workflows. So in the name itself, it says a registration form. So whether you're an A&E clinic or if you're accepting walk-in patients, you can allow them to register. So registering as a walk-in or a casual patient. So that's purely going to capture the patient's demographic information. It won't capture the declaration of entitlement and eligibility or their eligibility documentation. The other workflow is that I wish to register and enroll, where it's going to capture the patient's demographic information and all the information in eligibility documentation you need to enroll the patient. So for the purpose of going through this enrollment form, we'll go through the full process of I am a patient and I wish to enroll, just so you can get a feel for what is included in the form. So first up, we have the declaration of entitlement and eligibility. And it just asks the quick question that's usually centered at the end of the enrollment form, whether the patient is entitled to enroll because they're permanently residing in New Zealand. And the definition of permanently residing has been included at the bottom, which is in our standard forms that have been provided, that they intend to reside in New Zealand for at least 183 days in the next 12 months. If that's the case, they can click on this option and it's going to open up the next question. So are you a New Zealand citizen? Yes, I am, which would enable them to continue through the form, or no, I am not. So providing the other options for them to be entitled to enroll. So in the case that the patient is an Australian citizen and they are going to be in New Zealand for the next 2 consecutive years, they can continue through the enrollment form. So next stage is the upload of proof of eligibility documentation. If the patient's not entirely sure what documentation they're supposed to upload, they can click on the link here and it's going to open up the Te Whatu Ora checklist to say, okay, this is the category of my entitlement. It will present, I need to provide a NZ passport and or a New Zealand certificate of identity. So it just enables people to understand exactly what they need to provide when they're enrolling. So in the upload, it's going to look at their local device. So whether they're on their computer at home, it will look at the documents stored on the computer, or if they're on their mobile device, it'll look at the storage on their device, so their photos or saved folders. So in the case that the patient needs to upload this documentation, they can upload their birth certificate and their passport. So uploading multiple files. I understand you could upload up to 5 files, but there is a max limit of 3 megabytes. And in some cases, if a patient's taking a picture on a high resolution phone with their camera, it may exceed this if they try to upload multiple documentation. So the recommendation is for them to compress it or save it as a PDF, which would be a smaller file size for when they go to upload that document. So first up, we have a birth certificate to upload, and we also have a passport. So this would just add a description for when you receive it in case they haven't named it correctly. If it's just scan document 123, they can say, yep, that was my birth certificate. So on the practice's end, when you receive it, you'd be able to see, okay, this is the file that has been submitted, which you'd be able to open up and review that. So following them uploading their documentation for being eligible to enroll, they can continue. Next, they're prompted with the question of transfer of records. So in the initial phase of this, it's only going to capture the practice's name, their previous practice's name, and the location of the practice. So if they know the practice's address, they can add it in, and it's going to be presented to the practice when you receive the enrollment form. So the next stage, as I mentioned earlier, the ALEX or the Medtech registration enrollment form is both retrieving information from your Medtech setup, but also posting back in the demographic information. So there's a few fields that's going to redirect into your Evolution settings. So first is your titles. So if you open up your Medtech registration enrollment form and you're seeing titles that are misspelt, if there's specific titles that are missing, or if there's ones that you wish to remove, go into your Evolution settings under the patient register settings and go to title, and you can make changes to the titles that you've got set up in Evolution, and it'll make changes to the enrollment form. The other fields that we will need to make changes to is the relationship statuses, which you'll see on the next page. So if they go to select the title, you can see next to a lot of this information, there's an asterisk. So that's to indicate to the patient that it's a required field. If in the chance that they tried to progress without having entered information, they'll be able to say, please enter information into this field, because these are the fields that are required for when you're enrolling your patients. So we'll go and add a Mickey Mouse into the practice database from the form. So we'll just enter information, the date of birth, so residential address. In the case that they don't, or they have a different postal address, they can select that. It'll capture both of these, which will both be sent back to Medtech. But if their residential address is the postal address, they can enter it in to the field here, which is just a simple address lookup. Mobile number has been made a requirement, but in the case that they don't have a mobile phone number, they can be contacted by their home phone. So we'll put in the home phone number. So the final field on the patient details page here is capturing the patient's email address. And we do understand this is not a requirement for enrollment. And in many cases, some patients still don't have email addresses, but it's a key bit of information that our practices have been collecting for contacting patients. So from suggestions and feedback from our customers, we've made it a requirement. In the case that a patient does not have an email address, we do advise them to please contact the practice directly and follow the normal procedure for enrolling at the practice. So following the patient adding in their email address, they can continue now because they've filled out all the mandatory fields. So the next stage is additional details, which is more demographic information, which is captured as part of the patient's enrollment. So we have the sex at birth, the gender you identify as, the country of birth, the place of birth, ethnicities. So they can select up to 3 ethnicities, which will be sent back to Medtech. Preferred language has not been made a requirement, but it is one of the fields that are being made available for capturing information. And also EWE. So if one of the patients is part of one of the EWE, they'll be able to enter the information and it will be sent back to Medtech under the fields in Evolution. Finally is the emergency contact details. So we'll enter in emergency contact details, which will be sent back to Medtech under the contact, under next of kin, and we can enter relationship status. So again, this is one of the fields which reads direct into Evolution to see what has been set up. This will be unique to your practice, and in the case that there's specific relationship statuses, it's the place to go is into your Evolution settings to check what needs to be changed. Do I need to inactivate certain things, or do I need to add specific relationship statuses? And emergency contact number. In the case they don't have a number, they can contact the home phone number. Finally is the terms and conditions of registration. So here, this would be a field which would be entered into Medtech Evolution, which we'll see shortly. This is both a Medtech registration, or it's a registration and enrollment form. So there's a single field that's been created in Evolution to capture your practice's terms and conditions, both for enrollment and both for casual consenting or registration. So the recommendation for what this should look like, it is documented in the release notes, which we can provide to your team members if they want to see what has been recommended. But you can see a simple example of what I've got on the screen here, where at the top, it would be your registration and casual consenting terms and conditions. And there would be a line added to it to say, if I have chosen to enroll as indicated by my statement of eligibility in this section of this enrollment form, I agree to the terms of enrollment with the practice as follows. And then it would be the practice's enrollment terms and conditions. So it would include your PHO terms, your health privacy terms, everything that you have on your current enrollment form would be included under this. In the case that you're not currently accepting walk-ins or you don't have an A&E clinic, then it can purely just be your practice's enrollment terms and conditions. If the patient is signing on behalf of someone else, whether it's their child or for someone who is unable to sign for themselves, they would be able to capture that information for who has been signed for. If it's for the patient themselves, there's an electronic signing panel, which they can sign the form themselves. There's the final review, so where the patient would be able to see all the information that's been submitted, and they can have the option to print it and save it locally to their device, whether it's their computer or their phone. Following their review, they can have a look at the form and they can submit it. So the submission process, once they've clicked submit, the Alex integration platform will take that information. It would see that it's coming back to your practice, and it would send a bundle of the demographic information captured in the form back to the approvals process in Medtech Evolution for your team to review. So you can see the form's been submitted successfully. There's a message that you can customize in Evolution settings to say whatever you choose to say to a patient following their enrollment form being submitted. So here I just have, thank you. If you've got any questions, please contact us. Also, it's good to include if you have any standard procedure for your enrollment. So if you proceed, the enrollment forms every 24 hours, or if you have a process to review them every 48 hours, make that known to the patient so they can say, okay, I've submitted my form. I won't hear back from them for the next day. So any kind of information you'd want to display to the patient should be displayed right here. So I'll go into Medtech Evolution to see what this looks like on the practice's end. So you can see up on my Evolution ribbon that under the patient tab under home is this patient approvals. So if I open up patient approvals, it's going to show patient approval, the patient demographics, also some other fields, so screenings, medications, consultation notes, and classifications. So in the near future, there's going to be additional resources coming to Medtech Evolution, which will enable the write back or the information or clinical information to be sent back to Medtech for approval by your staff. Initially, all that's available at the moment is the demographic information. So you can see on the list here, there's various different patient information that has been sent through. So all registrations and enrollment forms will be sent back to the patient demographics tab here. So you can see the patient Mickey Mouse, which we've just submitted now, has already been received. And when you open it up, it opens up what looks like the F3 screen, the patient register. But you can see here, the way that we've opened it has come from the patient approvals. And you can see next to it, it says awaiting approval. And all the information is in this pink color or magenta color that is to indicate that it's come through and it's waiting approval. So this is the information the patient has submitted themselves. It's not your default setup like your GMS statuses or your next of kin, or sorry, your chart number that is default as part of how your Evolution configuration is set up. This is information the patient has entered themselves. So that's what you need to review when you're coming to approve the patient information. So all the information in the form has been submitted into the field which would be required for enrolling the patient. Under the enrollment funding is the new tab called Enrollment and Identity Records down at the bottom of the F3 screen. So you can see the online form has been submitted. If I'm to open it, let's open up my bottom screen, so I'll bring it up. You can see it's just a patient inbox record. You can see it's come into this new folder called Online Forms, which I can show you where to look for that on the patient record, also in the provider inbox. And it's just a notification to say this is the patient's enrollment. You can see there's the attachments here. So patient enrollment, so their enrollment form for all the information that they've submitted, but also the attachment for their eligibility documentation. So you can see the birth certificate and the passport. So if we open up the form, it's going to open up the web form that the patient submitted. So as a receptionist, as an admin staff, or whoever's processing the enrollments, you can come back to here. You'd be able to see the information that says the patient's eligibility. You'd be able to see the patient's transfer of records and all the information that was submitted in the form. If we come back to Evolution, we can open up the documents that they've submitted. So the documents they had submitted was just a PDF document. So in this case, it was just some documents on my device. So that was received. So whether it's the patient's birth certificate or passport, you'd be able to open it up, have it accessible through Evolution. So other documents or other information which is captured in the form under account, it's initially allocated as the patient being their own account holder. So in the case that a patient or it's a child of a patient at the clinic, you would need to manually allocate the AC account holder as the parent. Under more, it's the additional details which was captured. So the country of birth, place of birth, iwi data, and internal and external names. And finally, the contact, so the patient emergency contact information, which would be captured in the enrollment form. So following all the review, which is undertaken by your staff to check the patient's eligibility, so you've checked the information, you've checked the documentation that they submitted, and you've decided that they're eligible to enroll, all you need to do to add them to the database is to say approve. If in the case that they have not met your criteria for enrollment, or if you're not currently accepting enrollment, you can say decline and provide a reason for declining the patient's record. So this is kept internal, it's not displayed to the patient. So in the case that you would want to be honest about the reason that they're declining, whether they're a previous bad debtor, or in any case, something that you just want to make note to the team, you can make it a reason, add it in here and click OK, and it will decline the record from being entered into Medtech. So in the case that a patient record has been declined and you want to view the records that have been declined, you can come to the filter tab up here, click filter and see awaiting approval, remove that and see not approved records only. So you can see there's a date set currently from a specific date. So in the case that you just want to see what's been declined today or this month, you'd be able to come and search from here. So let's go what was declined for the last 2 weeks. So you can see Mickey Mouse who have declined was available to see in this filter, and you'll be able to review that information and have it accessible to see who you've declined. Similar for being able to view who you've approved. So if you wanted to see who's been approved in the last week, you'll be able to click OK, and you can see multiple patients have been approved for review in Evolution. So there's the steps that you still need to undertake as at the practice end. You still would need to do the NHI lookup for the patient, and you still need to do the NES syncing. You would still need to initiate the GP to GP transfer, so contacting the previous practice with the patient's information, requesting the information to be transferred back to your clinic. Those steps we still have not been able to automate, but that's what we're working towards with this new tool being added to the Medtech suite. So there's a few more bits that we just want to look at. So if we were to look for the patient's enrollment form once they've been approved, if you wanted to review the documentation at a future time, you can come to the patient register, the F3 screen, and under enrollment funding, as I showed before, there's this new tab for the patient inbox folder for the online enrollment form, but also the attachments for what the patient has submitted. This is also accessible from the patient inbox. So if we would go to the patient inbox, under the tab online form, you can see that there's this online enrollment document, which would be accessible either from the patient inbox or from the patient F3 screen. If a new document comes in and it hasn't been added to the identity and enrollment documents under the F3 screen, which I just showed, you can manually allocate it to that specific place in the F3 screen. So it would need to be under the online form folder, and you can manually allocate it by coming to the F3, coming to enrollment funding, and you can see there's these buttons here where you can open, you can add an existing inbox folder, or you can add an admin note. So in the case that you wanted to add another document, it's going to look at the inbox folder for online forms for the patient inbox, and it's going to retrieve anything that's been added to that folder. So this patient doesn't have anything in there, so it's not going to pull anything through. But in the case that they've had to send through a new scan of their visa or a new passport photo, it would be received and it'll be accessible through this tab. So that's the process for what you would need to do to the patient submitting a form, and also what you need to undertake at the practice. The way that you would configure the form is all inside the Evolution PMS. So as I mentioned, there's the prerequisites to upgrade to version 6.2, but also to activate Alex. And in both those cases, if you have not, you would not be able to access the configuration in Evolution, but also you would not be able to launch the form. So contact your IT provider if you have questions about whether you've upgraded to 6.2. For those who are on the Medtech cloud, you have been upgraded to 6.2 already. So we're working through that process now to activate Alex at all of those clinics. So please bear with us while we go through that process internally. So the steps that you need to take to access the approval function or the patient approvals to be added to your receptionist, to any staff member who requires access, is come to the Evolution icon, open that up, come to options, which would open up your Evolution settings. And this is all managed through the access privileges. So coming to each individual role. So for this case, your reception team would require access to the patient approval tab to view the enrollment forms coming in. So under home, you can open up home, patient, and down the bottom is the patient approvals. So in the case that it's a receptionist or an admin team or any of the team leads on the front end of the practice, all they would need access to is the patient demographics. So that would receive the registrations and enrollment forms. In the case that you're adding it to a GP who requires access, to a nurse manager or anyone who has a clinical side of things, adding the other approvals functions down here just to future-proof it for when additional features come to Evolution that will receive clinical information For example, the medications may receive new medication script requests coming in that would automate the script process, just enabling people to have access to that in the future, so you don't have to come back in and add it for those clinical team members. So in the case that this is a receptionist, they'd only need access to the patient demographics, so we can click add and OK, and that'd be the same for all of the staff members who require access to this patient approvals. To complete the setup for the enrolment form, as I showed earlier, there's different bits of information on the enrolment form. So let me just go back to the enrolment form. So you can see here, this is the practice's logo. This is the header. This is the footer. And there's also the terms and conditions, which is on the page where the patient is signing for the enrolment. So if we come into the Evolution icon, to options, location, and under location settings, there's information that you'd need to enter in to customize the form for your practice. So if you're a multi-location practice on a single database, and you'd wish to have an enrolment form for each location, if you have different funding models, if you have different terms and conditions, you can set up a unique form for each of your practices locations, but you'd need to go into each location to make those changes. In the case that you just want one enrolment form, then you just need to make changes to a single enrolment form. So we'll open up this location, and you can see there's a new tab here called Alex Forms. So under Alex Forms is where you'd configure and upload your practice's logo, your header, which would be the text displayed at the top right hand of the enrolment form. So in this case, my practice is displaying the name, contact number, address, the EDI, and NZMC. So when I save the enrolment form, it's visible on the enrolment form. The footer, which is displayed following the patient submitting the form. So it's customizable, so you can display what you choose to display. And finally is the terms and conditions. So here you'd be able to copy and paste in your terms and conditions for what you currently have on your enrolment form, so it's displayed to the patient. The other or the final bit of information you'd need to configure is under codes and defaults. So under the defaults for default providers, there's a notification that's sent to the provider inbox to say there's a new patient inbox record, which I was displaying earlier, that would have the patient enrollment form link that you can find the attachment, but also the eligibility documents that they've attached. So the recommendation here is to send it to the admin team lead, to the reception lead, to the practice manager, anyone who would be able to triage that, and just have another ping to your practice team to say there's a registration form being received. So once you've made all the changes to that, you can click OK. You have to exit Medtech Evolution to see these changes. And once you've made those changes, when you come to your enrolment form, you'd see those changes automatically reflect instantly on the enrolment form. So you'd see your logo being uploaded, you'd see the header, the footer, and your terms and conditions. There's quite a comprehensive user guide which would display everything that we've gone through today for the configuration. If there are any questions, you can flick it through to our support team who will provide assistance with getting this set up for your team. So that really is the enrolment form. We've gone through all of that, the enrolment form prerequisites. So why don't we open up the floor to some questions and answers? So I'll just go through the Q&A function. So there's a few questions here already. So what I'll do is I'll read out the question and I'll be able to provide an answer. If in the case that we can't provide an answer to a specific question, we can follow up with you afterwards. Do see people have entered under their own name, so that's perfect. I can follow up with you afterwards. So the first question is the enrolment form up to Ministry of Health standards? So the whole basis of building this form is we've built it to Ministry of Health standards. All the information that has been requested and the wording of the document and everything has been built to their standards. So yes. Next question is, if the transfer is automatic, will indice notes be made or be available to be automatically downloaded in Evolution or Medtech, as this does not happen. So I think you're referring to the current GP to GP transfer process, which when it's coming from another PMS and it's pulling data through in a different format, it's having difficulty coming back into Medtech 32 and Evolution. In the future, when we do the transfer of records automation, which would be using the Alex platform, which is our integration platform, and it has the capability to retrieve patients' health information from another practice to bring it back into Medtech for approval, it's not going to have the same issue because you're pulling data through a standardized method, which will be pulling it through Alex, but it's coming in the same format from another Medtech practice. So in the future, when we do build up that capability, you're not going to have the same difficulty that we've had currently with the formatting of patient information. Next question is, hello, do you allow shared email addresses? So yes, in the case that patients are sharing email addresses, it's just going to capture the information so you have something to contact. It's not like registering a patient to a portal where they have to have unique email addresses. It's purely so you have a way to contact people moving forward for when they're an enrolled patient at your clinic. Another question, none of our 11 practices are enrolling people who want to change GPs. There's only capacity for 3 practices to enroll new people in the city with no existing local GP. No practice is taking casual patients, so does the link just get sent by reception to approved people wanting to enroll? So it's really up to you how you would want to use the enrollment form. Currently, there's different methods being employed by the people who have used it. So some have put a button on their practice website to launch the form, because in the case that they may be accepting enrollments at an A&E clinic that is capturing demographic information as well. All of that's fine for them because they open their books. You have the option to send it to approved patients only. So in the case, you could create outbox documents for SMS, for text documents. So when you're sending out Outlook emails, you can send it to specific patients. Someone might come into your clinic and say, I meet the criteria for enrollment at this clinic, and you could just provide it to them either by showing them the links that they can access it. So yes, you don't have to share it with everyone. It would be something that you can keep away from specific patients if you do not wish for them to enroll. Next question. So what if the patient doesn't fill out information from previous GP? Notes are always needed for best medical treatment. So in the case that the patient does not fill out the information, we can't restrict them from not filling it out. So they're given the option to say, yes, transfer my records, no, don't transfer my records, or not applicable, in the case that they may not have records at another clinic. We have not made a restriction for them to enter that type of information, but be interested in connecting with you just to understand that use case a bit more. So if you could just contact our team, I'll get in touch. I will drop my email address in the chat, so you've entered under an anonymous attendee. So just get in contact with me just so we can talk about what that might look like. Next is, can a patient save a status of their registration form and come back to it later? So there's no saving process where they can park the document like you would in Medtech 32 over Evolution. The reason for that is, of course, if they're on their own device, that's not going to be a problem, that they can save the information away. But the way that the form works, it doesn't save the patient's information. The way that Alex works is it will capture it in the moment. It will send it to the clinic via the Alex platform to your Evolution, and it's not going to save it on the browser or anything. It's not going to cache the information like a normal form would. So there's no way that the patient would be able to park that registration form. They would have to enter it at the time of them entering all their information. But it's quite a simple process for them just to go through. It can be completed in a few minutes, and it's not capturing an extensive amount of information for them to, if they've entered one bit of information, for them to close it and come back to it to complete their setup. Another question, in the setup, can multiple NZMCs be shown? How do you select a specific doctor if the patient has requested a specific doctor? So this is one of the main recommendations that we've had from the practices that have been using it, is that it doesn't have the option to say, I would like to register or enroll with that specific GP at that clinic. So the reason that we've gone for the standard-based form now is each practice has their own specific requirements. So we've built a standard form based on Ministry of Health requirements that enables people to start collecting demographic information and enrolment information. So as these recommendations come up, we'll start to include them. They have to understand that not every practice has that same process that allows them to pick the specific GP that they would like to enroll with. I do understand a lot of people have that, but we need to work through what that would look like in terms of configuring it and making it available on the web form. So being able to add multiple NZMC numbers, you could add it in the practice header. We may need to look for some new space on the form where you can add, if you have a significant number of MZMCs or any type of information you'd want to be displayed in the enrolment form. So again, please reach out to us. I'd love to understand what that might look like or how you'd want that to look, just so we can keep building off the current enrolment form. Can the online registration form and enrolment form be linked to our practice's website? Yep, of course. So the way that you would do that, you'd create a button on your website. It could just be a link text that would redirect the patient to the enrolment form. It's a pretty seamless process that a few people have already implemented at their practice, and it's working quite well for a lot of them. Another question, so if a patient uploads a file that has all family members' passport, visa details, is there any way when processing to import on 2 of the 6 pages, for example, is there any plans on the form to get consent for using mobile number when texting the patient? So first part to that question, if they've submitted a form with multiple eligibility documentations in a single document, yes, you could save the document, you could split it off. So this patient's 2 bits of information is stored separately, but then you would need to manually import it back into Medtech and allocate it or to save it against the patient's record. So it is something that you can do, but it would be manual work. It's again a use case that we could look to explore in the future. Is there plans to getting consent? So yes, so there is the no SMS, no contact, no email flags in the patient F3 or the patient register. So we are exploring those to capture that information, so it is available to patients to select. At a practice, can you see if Alex has been activated? Unfortunately, the way that Alex works is it's something that sits in the background. It's not a a tool that's available to see in the front end of Medtech or something that you can just see if it's been activated. The way that it's designed is to not get in the practice's way. So it works in the background of the Medtech system. So you wouldn't be able to identify whether you are activated or not. You might be able to tell whether you're using one of the integrated partners. You could check with your IT provider if it's been activated, or you can reach out to our team and they'll be able to tell you whether or not it's been activated. So another question, can Evolution recognize if the patient has had a previous enrollment at the practice? Would this stop patient duplicates? Yes. So if you're going to save a patient and there's a duplicate account, it will read the patient's identifiers, so the patient name and information. So it will prompt you to say, there is a duplicate, do you wish to continue? It will display the patient's name. So in the case that there's 2 Mickey Mouses, it will say, it would display this to you. So whether you would remove or if you would do a kind of manual work to put that information across, or you could use the patient join if you're validated that it is the same patient and you're confident in joining those 2 patients. Another question, are you able to make changes in F3 prior to approval? Yep, of course. So you can make changes to the F3. It's the same process of having the information in Medtech. It's customizable to you, but it just saves you from having to enter all that, that manual typing from the paper-based or PDF forms. If something needs clarification, can you put the registration on hold whilst you communicate with the patient to clarify something? And can this clarification be via the system or external through email? So in the case that you need to contact the patient because their eligibility documentation has not, it's the wrong file, for example, or if you've identified that something's missing from their enrollment, you can just let it sit in the enrollment form. So there's no separate bucket to put them in to say that this one's on hold, but you can communicate to the patient. So it would be either via SMS, call, or email, your normal standard procedures for contacting the patients. There's no built-in functionality for the form to contact the patient through this enrollment process. Is there a connection between the enrollment form and the Manage My Health patient portal registration data sharing? No, there's no connection at the stage between the enrollment form and Manage My Health portal registration. So it'd be interesting to understand what the use case is there, whether you wanted to pull information direct into the patient registration for Manage My Health. If it's in the F3 screen or the patient register, when you go to register a patient for Manage My Health, it should be pulling that information through for you to register the patient. Can we customize fields on the enrollment form? So currently the web form is a standard form that we've got out to practices, and it's not yet customizable. So if there's specific fields that you are missing, if you want to have free text field, just whatever recommendations or questions you do have, reach out to our team and we'll be able to see what we can add, what the customization may look like moving forward. What happens if patient's already in the system? As I mentioned before, you'll be prompted to say there's an existing patient record under this name. Do you wish to continue? You can review both of those bits of information or the patient information in the F3s just to see whether it is the same patient. In that case, you can either decline the record and use the current patient with the eligibility documentation coming through, or you can do a patient join. Can you undo an enrollment that has been deleted? This is something that's been raised by the practices who have been using the enrollment form. So currently there is no process for if you decline a patient's enrollment, it's at this stage been a hard decline. So if a patient is declined, you will not be able to undo that. It's a use case that we're working through now to understand, if in the case that someone accidentally declines or they have declined them, but they weren't meant to, then we're working through that process of what it might look like moving forward to enable people to reactivate. So at this stage, it's not currently available, but we're working through that with our team. Is the patient aware if we decline the application, and how are they notified? So at this stage, the patient isn't automatically notified as to whether their enrollment's been approved or declined. You still would need to contact the patient for your normal standard procedure. So if they've been approved, you'd send out the welcome pack, which might include the medical questionnaire, just information about the practice, your standard procedure. If the patient's been declined, it's not going to display the reason for you've declined them, which you enter in the F3 when you're declining the patient registration. You would need to contact them directly, so whether by email, text, or calling them to notify them of the declined enrollment. When upgrading to Evolution, do you pay extra to activate Alex? So when you upgrade to Medtech Evolution, so Alex is already available to Medtech 32 and Evolution people now. It's not at an additional cost to activate Alex. It's not a cost incurred or not something that's charged by Medtech. In the case that there is a charge incurred, please contact us because no one's we're not charging people to activate the Alex platform. Can you undo a declined registration? We've just covered that one. May have missed it. Where do I find the web address for patients to request enrollment? So is that referring to the URL for the actual enrollment form? So the enrollment form, it's a standard URL, a web address. The unique key on the web address for the enrollment form is your practice's facility ID or your Ministry of Health HPI facility ID, which is stored in the in the practice's location settings under the codes and defaults. So that's how the Alex platform maps the enrollment form. to your practice's enrollment or to your practice's Medtech database. So in the configuration guide, it has the standard web form link that you'd be able to see, and you just need to make a change to have your practice's facility ID, which is in the location for the practice you're setting up for, and that will launch the form. So if you get in contact with our team, we'd be able to send out the configuration guide and you'll have access to the web address. How does it allocate a chart number, and what are these used for now? So the chart number would just automatically allocate the next available chart number. Do the ethnicities order as Te Whatu order requires, i.e. Māori is required to be ethnicity 1. So this is something that was brought up to us, our team, and there's an investigation going on to how that can be managed through the platform. So at this stage, it does not automatically allocate the specific ethnicities in the order that you're suggesting to. So we're working through that process now. Will there be an option to add a patient health questionnaire in the future? Potentially, there is the option for adding something like that in the future. I'd be interested to understand what that would look like for your practice. As I mentioned, this is a registration and enrollment form to capture demographic information and documentation along with the enrollment. So it hasn't captured any clinical information for a patient to be sent back to Medtech. But I'd be interested to understand, what your patient health questionnaire looks like and what it could look like in terms of an integrated solution in the future. So get in contact with our team. Can you import passport and DL info as JPEG rather than a PDF? So it would just, whatever the format of the documentation the patient has uploaded will be the same format as what's received. So in the case that they've uploaded a PDF, it's going to be received as a PDF, which you can do some manual work to transfer it over to be convert it to a JPEG, but it will be received as how the patient has submitted it. So another question, can you display a QR code that we can display or send to patients? So you can create a QR code. There's various different tools that can create a QR code just using the unique link. It's something that the team can work through when you get your enrollment form set up. I do see that we are running close to 2 o'clock. So for the remaining questions, there's quite a few questions that have come in. I will export these. I'll start to get in contact with you just to answer some of these questions following this. There's quite a few questions. So I have to come back to these after the webinar. So again, thank you everyone for joining today. So just to recap on the Medtech registration enrollment form, it's available as part of the Evolution version 6.2. All we need to do is get you upgraded. We need to get Alex activated at your clinic. So get in contact with our support team if you're not sure whether you've been up or activated or not. And we can provide or do the configuration on our end to connect your practice to the enrollment form, and then also send out the information of how to activate or configure this enrollment form. So that was all covered today of what's required by the practice to get this up and running. But thank you everyone for joining. The webinar has been recorded. So if in the case you want to get a copy of the recording, just contact our team and I'm sure it will be uploaded to our platforms, our social platforms at some stage. So thank you everyone and have a great afternoon.